Okay. Thank you, Rhonda, for hosting the first half hour, and welcome everyone to tonight's Policy Crunch event. I'm Jeff Kinder. I'm the Executive Director for Science and Innovation at the IOG and the host of Policy Crunch. Policy Crunch is our monthly speaker series where we delve into issues around disruption and convergence in public policy and governance. And tonight's event is a very special one with a stellar lineup of speakers. Before I go any further, I would like to acknowledge that those of us in Ottawa are convening on the unceded territory of the Algonquin Anishinaabe people. Before I turn it over to Eric Meslin, who will be serving as our moderator tonight, let me just give you a sense of the format for the next hour. Eric will introduce the speakers, and they will each have a few minutes for opening remarks. We will then have plenty of time for discussion with the audience, where you'll be able to ask your questions and provide comments. And we'll do that right up until the top of the hour at 7 o'clock, at which time we'll draw the formal portion of the evening to a close. But we will have the opportunity then to put the speakers each into a Zoom breakout room, so that if you are interested, you can join the breakout rooms to perhaps ask a question you weren't able to get in during the main part of the program, or to just follow up in discussion with each of our speakers. Unfortunately, Carly will not be able to join us for that portion of the program, but our other speakers and moderator will be able to do that. So without further ado, let me introduce my dear friend and colleague, Dr. Eric Meslin. Eric is the President and CEO of the Council of Canadian Academies. He's a bioethicist by training. He has a long, esteemed career. I'll just note that among his many accomplishments, he served as the Executive Director for the Bioethics Commission under the President Clinton administration. So, Eric, without further ado, over to you.
Thanks very much, Jeff, and welcome everyone to this evening's events. I think you've heard from Rhonda how excited IOG is, and I can just tell you from the perspective of the panel members, we're equally excited, but we're also very grateful to the Institute on Governance. Toby and your team have done just a masterful job of pulling together these policy crunches, and we're excited to be a part of it. Given yesterday's press release by Pfizer announcing data from an interim analysis from a placebo-controlled clinical trial of their prospective COVID-19 vaccine, I don't think we could have asked for a better setup for this evening's webinar. In fact, we could probably use it as a case study all on its own. It's got all the elements for a fascinating conversation on ethical, legal, social, regulatory, communication, and public acceptability issues that vaccine development and rollout raises. Just consider one aspect, that the announcement focused on an interim analysis of a number of patients and produced a report of 90% effectiveness, which is very different from what we might end up seeing when the study itself is complete, whether it goes to full completion or is stopped for reasons of risk and benefit. That's because the nature of research is that evidence accumulates over the length of a study. And even if this vaccine or any of the others are approved for use, data will be collected on those who take the medicine for months and for years. And all of this affects the way that research information is reported, how it's used by clinicians and public health authorities, and most importantly, how patients and families will make decisions about it. These are profound and current bioethics issues. And if the Pfizer story wasn't enough of a booster, today is reporting in Ontario's newspapers that a further 65,000 doses of our seasonal flu vaccine have been identified, adds to the ongoing challenge of how to think about vaccines in society today. It adds an important element to tonight's discussion. So now it gives me great pleasure to introduce our speakers this evening. I've already alerted them that I'll give just a very brief intro. You can track them online and find out more about them so that we can give them maximum time for their remarks. Well, I'm going to introduce all of them at one time, and then they'll just speak after one another again for more efficiency. Alice Sleerackers is a freelance writer, a researcher at the Scholarly Communications Lab, a Science and Society editor at Science Borealis and the research officer at Art the Science. Alice is also a doctoral student at Simon Fraser University, where she is studying how uncertain science is communicated online. After Alice will be Pascal Michel, the Chief Science Officer at the Public Health Agency of Canada, who has a number of responsibilities for overseeing and leading excellence and innovation in the agency, as well as providing corporate leadership on science policy issues. After Pascal is Zubaka Bogu, Associate Professor in the Faculties of Law and Pharmacy and Pharmaceutical Sciences, and the Katz Research Fellow in Health Law and Science Policy at the University of Alberta. Finally, Carly Weeks is a health reporter with the Globe and the Mail and has been writing and reporting on health issues for the past 10 years. As Jeff and Rhonda have mentioned to all of you, once the speakers have given their remarks, we'll be opening it up for questions from all of you, and we hope we can have a healthy and robust discussion on this. So let's begin, starting with Alice. Go ahead, Alice.
Thanks so much, Eric, and everyone. It's really amazing to be here today. Yeah, as Eric mentioned, I am an aspiring academic. That means I am steeped in science and health communication research. I'm doing my PhD in this, so I could easily use up this entire 5 minutes just talking about the incredible work that scholars are doing, trying to help us understand how to communicate more effectively about topics like vaccines. But instead of talking to you like a scientist, I actually want to do something a little bit different. I want to speak to you as a human, a messy, emotional, and sometimes very irrational human. Because I am the child of 2 very loving, very caring, vaccine-hesitant parents. As a result, I lived most of my adult life missing many of my essential childhood vaccines. It was actually only last year at the age of 27 that I finally decided it was time to catch up. What I learned from that experience is that becoming immunized as an adult is so much harder than you would expect. There are logistical challenges like which vaccines you actually need, which ones you're missing, how much it's all going to cost, and where on earth do you get that help? There's also communication barriers because so much of the communication around vaccines is tailored to new mothers and new families who are just making that decision for the first time. There's not a lot out there for people like me who are confused adults considering whether or not to go back on the way that they were raised. But more importantly, deciding after more than 2 decades to become immunized is incredibly emotional. It means confronting the parents who raised you and worked so hard to protect you from what they believed was a dangerous and potentially life-threatening medical procedure. It means letting go of very deeply ingrained beliefs that are rooted in powerful stories and personal experiences, which unfortunately often trump cold scientific evidence. It means battling stigma and stereotype in a society that often ridicules people who are skeptical or hesitant about vaccination, that others them as anti-vaxxers. And most of all, it means putting trust in science rather than in your family and your personal experiences. It means putting trust in something that can sometimes be contradictory, often uncertain, and almost always difficult to understand. This last challenge about the uncertainty and the complexity of science, as we all know, is only becoming more important in the context of COVID-19, where the unknowns surrounding a potential vaccine continue to outweigh the knowns. So I think it's really important that as communicators or policymakers, or even just members of society, we acknowledge that uncertainty. The uncertainty that's inherent in all science, but especially when it comes to science topics as new and as evolving as something like COVID-19. Even as we move forwards with potentially what could be our first vaccine, we have to acknowledge that there will remain unresolved questions. There will be conflicting results and differing interpretations, as there is with all science. And yeah, to those of us within the science community, those uncertainties can be normal. They can even be desirable as a core component of the scientific process. But to outsiders, to people like my parents, and for a long time to people like me, they can be very disorienting and very disconcerting. They can eventually become the seeds of doubt. And so as we move through the next 50 minutes and hear from these amazing other speakers, I would really like to invite you to consider the last time that you felt doubt. The last time that you sort of deeply questioned whether you were really making the right decision about your health. I would like you to remind yourself of a moment when your own lived experiences seemed to contradict the available evidence. To acknowledge the emotional, the messy, and the wholly unscientific aspects of so many of the vaccine-related questions that our society is facing right now. In short, I would like to invite you to approach the rest of the hour, not just as scientists and policymakers and experts in your respective fields, but as human beings, whatever that looks like to you. Right. Thank you. I'll pass it on to Pascal now.
Thank you. So thank you, Alice, and so grateful to be here tonight with you. I'm going to use a common thought there on the trajectory that both Eric and Alice presented. And the second broad outcome that I'd like to bring up with the short intervention I have is really one of empowerment. So here I have three thoughts there that I'd like to set on the table there to start. When we talk of vaccines, I think we first have to think of and to talk about infectious diseases. And so infectious diseases are those conditions that are brought to us by a living being, bacteria and viruses that we get in contact with. So over the whole past history of whole humankind, as far as we can think, we have had a much changing relationship with how we deal with infectious disease. And first, we didn't know about them, and people were dying of simple infections. Then we got acquainted with them, we recognized them, science advanced, and we got some tools to fight them in terms of antimicrobials and advancing our hygiene measures, and came the invention of vaccine. And quite relatively quite successful we were with the battle of infectious disease. We can name a few kind of a big files we had with the polio virus, the smallpox, and how advanced we did with the childhood disease prevention. To the point that I'd like to bring is the North American psyche and the Canadian psyche in the 70s and 80s and 90s. With some exception, infectious disease were no longer top of mind for many in the population level. And at the public health, although we had major challenges with some infectious disease, the bulk of our thoughts were into environmental exposures, toxic hazards, smoking, nutrition, obesity, many things that were affecting us in terms of populations due to our sedentary lifestyle. So from a public perspective, I think, and that's my first thought there, is that we may have lost sight, at least partially, on how dangerous infectious disease can be and how impactful they can be on our way of living. We may have lost a sense of perspective on the critical need to invest ourselves as individual and as member of community. And when I use the term invest ourselves here, and of course I'm thinking about government dollars, but also very much on the personal commitment level. We need to give. We need to, lead, innovate, behave, and convince in a way that we can fight those infectious diseases. We also need to concede in some way in our rights and ways of living. One of the key word that you can have right now is the word of restrictions. I've never thought that word would become so much of a key word. So my second point, I'd like to talk about the science of vaccine. So again, briefly speaking, when exposed to a virus, the human body has different ways to react it. And so you may get sick, you have fever, you have cough, but also what happens is that the body reacts to protect you against future reinfection of the same type of pathogens, of virus. So this is called the immune response. So broadly speaking, the body does not make much of a difference between whether this exposure is a natural contact, someone cough on you and that bug got into you and you're fighting it, or through an intentional contact, through vaccination of some part of the virus or inactivated part of the virus, if you want. So the body does not care much about the intention behind that exposure that you get. And from a physiological perspective, this is much of a natural reaction as it is. So now, what we're really expecting from a vaccination is quite different than what we are kind of expecting out of getting sick, is that we want to have the protection, but we don't want the bad outcomes, to get sick and potentially dying of this. So this speaks directly to efficacy and safety of vaccine, and Eric brought that up. That when we speak about efficacy, this can become very technical, and we have to unpack this. So the features have a direct relationship in how we feel about vaccine. For some, the enthusiasm of getting vaccination is very much linked to the safety side of this balance. It's about risk tolerance. And for others, the acceptance correlates very much with the efficacy side of the equation. What do I get? What's the benefit from it? From a public perspective, and that's what the angle I'd like to take tonight, it's really hard to make a full appreciation of the notions of efficacy and safety for every vaccines candidate that you can think. So we need to trust a whole bunch of people to unpack this for us and to bring well-informed and open information in front of us. And so this relationship in between how we react to vaccine and what do we know about them comes through a filter of information and trust. And that is absolutely critical to understand for us. And quickly, I know that my time is running out here. I'd like to talk about the flip side of vaccination. Vaccination is not the end point. The end point is protections of people in the population. And I'd like to speak about the science of immunization. So when you get vaccine, or immunization works at two levels. At the individual level, I get a vaccine and I get protection. But it also works much different, and the concept there is so important. It works at the group level, and the group can be at so many different levels. At the group, your bubble, your community, the globality of the world, if you want. I get vaccine and you get protected, or I get vaccine and many others get protected. Notionally, in the same way that vaccination is an investment, vaccination is also a gift. We can actually say, I give this protection to you when I think about my older mom, when I think about my sick neighbor, when I think about a kid that I know that is battling cancer, I have a protection for them. When you pull this all out at the population perspective, immunization is very much the same concept as clean air. Your personal action is influencing clean air, and that clean air is equitably benefit for everyone. No one can be excluded from it, and no one benefit from it can compete with someone else accessing it. The global immunity that we mount is in that sense, a very sense of a common good. So one of the driving force of us discussing the ethical considerations of vaccine, I'd like to also to not only focus on the vaccine, but on the immunization side of things. And this is where the lever gets back into your hands, and think of this as a public good, not only as something that you can have for yourself. So on this, I'm going to close those remarks and very much engage in following that conversation. So thank you.
Thanks, Alice and Pascal. That's tough acts to follow. So I'd like to, in my remarks, to focus on the debate and policies around vaccines and vaccination. And what I'm going to try and do in 5 minutes or so is sort through 2 to 3 ideas that help us understand the debate and policies around vaccines and vaccination. The first thing I'd like to sort through is how we use terminology in describing reactions to vaccines, especially for the purpose of creating policy to address vaccination uptake and reduce resistance to vaccines. So you may have heard Alice mention the idea of vaccine hesitancy, which is this idea of a delay in acceptance or refusal of vaccines despite the availability of vaccine services. Vaccine hesitancy is a term that has gained a lot of support among people who study vaccination policy, and they think of it as a continuum of beliefs and attitudes about vaccines rather than sort of a binary accept or reject vaccines. That's why it's a good term, because it describes a continuum of beliefs that starts with total rejection all the way to acceptance, but with some doubt. However, the use of the term, which in popular usage means uncertainty, doubt, or the state of being undecided, suggests a generally passive attitude to vaccines and vaccination, as opposed to active opposition. In my view, active opposition to vaccines does exist and is better captured by the term anti-vaccination, which I think is somewhat of a different flavor than vaccine hesitancy. Active opposition to vaccination is not a matter of hesitancy, although the reasons for active opposition might in fact correspond to the reasons for hesitancy. One key difference, I think, is that anti-vaccinationists are often militant against vaccination. I studied this for my PhD. Various anti-vaccination movements have existed since vaccines were discovered in the early 19th century. I also don't think vaccine hesitancy as a term captures non-vaccinating populations, which are populations that reject many types of human medical interventions, including vaccines, because of the belief that they interfere with divine will. Understanding this terminology is not just important for its own sake, it is also useful in formulating policies and programs for vaccination uptake. For example, encouraging uptake in a non-vaccinating population might require the use of pastors or religious people, religious ministers, than public health officials. This is an oversimplification, of course, for the sake of keeping my comments brief, but I'm sure you catch my drift, and I'll be happy to talk more about this in the Q&A. Another related point is that there's also a diversity of vaccination programs with diverse futures and considerations. Resistance to vaccines also reflects a diversity of considerations. For example, vaccination programs that target children attract objections that may not exist for the flu or COVID-19 vaccine simply because they target children. Vaccines for childhood infectious diseases generally confer longer lasting and in many cases, lifetime immunity, as opposed to the flu vaccine, which does not confer lifelong immunity or even immunity to viruses that are not matched to the virus that the vaccine is based on. So the COVID-19 vaccine will probably arrive without long-term safety and efficacy profile and without safety and efficacy benchmarks for certain populations that were not included in the clinical trials, such as the elderly. By contrast, the safety and efficacy profile of vaccines for childhood infectious diseases is very well established. I could go on about these differences, but the point is that policymakers need to pay attention to these differences when they are designing vaccination policy and when they are designing measures to deal with vaccine hesitancy or anti-vaccination, as the case may be. My point in essence is that there's no one-size-fits-all approach to vaccination policy aimed at addressing uptake or reaction to vaccines. One last point that flows from all of this. One consideration I think that is unique to COVID-19 and the COVID-19 vaccine, and which I think should drive policy, is the potential demand relative to supply. This, I think, is the key difference that doesn't exist for the other types of vaccines that we have, the demand relative to supply. As has already been mentioned, affluent jurisdictions, including Canada, the US, EU, Japan, have already secured the full stock of the Pfizer vaccine up until the end of 2021. If you don't live in these countries, you're out of luck. These stocks may not even be enough to vaccinate the entire population within these jurisdictions. It might not be enough to even vaccinate everyone in Canada. I think this creates allocation issues that will need to be sorted out, both within nations and across global or international lines. I am speaking of not just allocation, but fair and equitable allocation. This is an issue that's going to consume bioethicists over the next few months. And it's made more complex, of course, by the fact that the vaccines are being produced without any attention to something I call inclusive or universal design. The Pfizer vaccine, for example, requires storage in very cold temperatures that may not be available in developing countries or even in certain communities within developed nations like Canada. So that's one issue I think we need to pay attention to, and I'll stop there. And I look forward to the Q&A and to having a discussion with everyone. Thank you.
Okay, now it's my turn, and I have a fussy baby with me, so please bear with me. I'm a journalist, and I've been covering health issues at the Globe and Mail for many, many years, as the introduction said. And I've specifically reported on vaccine-related issues a lot. And one thing that I've sort of seen happen is that I think we've become, as journalists, better at combating and not repeating misinformation in our journalism. But at the same time, social media and the entities online have become much more sophisticated at sort of spreading their own misinformation and making it virtually sort of, impossible to stop the spread of false information and lies about vaccines. And so I think the situation we're in right now is a really complicated one, where public mistrust of government vaccine programs is sort of on the rise, and we have a pandemic. And as I was saying, on our prep call, it got a couple laughs that this is now. This has put the anti-vaccination sentiment on, sort of put it on steroids, this movement. It's moved it ahead, I think, and accelerated the anti-vaccine movement by decades in a sense, because this is now an issue that everyone has a stake in. We're all tuned into COVID-19 news. We're all paying attention to the latest developments, and we're all wary of a potential vaccine in a sense. I mean, what I mean by that is that I think there are sort of legitimate reasons, as speakers already have alluded to. There's various reasons why we want to be sort of skeptical of this new vaccine. It's never, obviously it's not even ready yet. There's, so many companies racing to produce one. We don't have long-term trials, and we won't have any long-term trials. So there are good reasons to sort of be skeptical and ask those questions. And I think it's just like sort of the perfect scenario for the anti-vaccination community, because they can rightly say, this hasn't been studied, in many people. This hasn't been looked at over the long term. I think the challenge going forward will be to improve the public sort of confidence and trust in a COVID-19 vaccine and other vaccines as well. And I think this really does, this dilemma that we're in speaks to a much larger issue, which is, as I mentioned off the top, this idea that many people simply don't trust public health officials and public health messages. They're getting their information on social media. There's something like 1 in 3 Americans, and I think this would apply to Canada as well, their primary news source is now a social media platform. And sure, you do have, some like legitimate news organizations sharing their information on social media, but as anyone with a Facebook account can attest, it's the misinformation, the memes, the false information that seems to spread so much faster. And so while, a lot of public health officials are very busy trying to figure out how best to respond to COVID-19, how, to get people tested and get those messages out, I think one thing that tends to slip by the wayside is improving public communication about some of these very complicated issues. For a long time in my reporting, I've spoken to numerous experts over the years, and there was this prevailing idea that if we talk about the anti-vaccination movement, we just give them oxygen and it makes everything worse. And I think what's happened instead is we've not talked about it, and we've created this vacuum where the anti-vaxxers have become masters at managing clicks, likes, and shares on social media. And so they're getting sort of all the traction on where all the eyeballs are, on Instagram, on Facebook, on, all the Twitter and the like. Although I think Facebook tends to attract the biggest anti-vaccination groups, even though those social media companies are fighting back and they're, sort of getting rid of some of these groups. They're still there and they still have a huge following. So I'll keep it brief, but my biggest sort of message I would like to convey is that, we try at the Globe and Mail to communicate some very complex health ideas on a daily basis. Sometimes we get it right, sometimes we may not. But I think that the biggest point is that we are, all of us have a huge stake in improving public health communications, and it can no longer be an afterthought. This should be something that's right off the top. I mean, it doesn't take, you just look at what's going on south of the border with the election, just to see how corrosive and toxic and dangerous misinformation can be. So, we need to realize it for the threat that it is and figure out new strategies to take it on.
Well, thanks, Carly. Thanks to the panel. This is where I'm supposed to earn the big bucks that I got paid to moderate this evening. There are many blank screens because we know your video is off at this point. And what we're going to do is we're going to open this up for questions. Becky Hollett is curating the questions online. Some are coming in through the chat. She's hopefully sending me some of them on my phone through a Google Docs thing. So if this thing works, it'll be pretty impressive. We'll accumulate a few of those questions before we start launching in and just reading them. I wouldn't mind maybe warming up the panel a little bit. First of all, having thanked them for their really, in two ways. The presentations themselves were crystal clear and spot on, and they were on time, which is equally appreciated. So we can open this up to the group. The title of this session has bioethics in it, and we haven't really talked a lot about bioethics. And I don't mean from a professional bioethics standpoint. We're all bioethicists. We're all interested in biomedicine and how it affects humanity. There's nothing especially expert or elitist about the idea. Anyone who cares or is concerned about the health and welfare of others, who's concerned about being adequately informed to make decisions, making choices that are good for them and for their family and their community. You're all official bioethicists this evening. So I'm actually going to maybe open this up. I'm going to target a couple of the panel members, not in a gotcha way, but just because I think it works out well. One of the things that Alice raised was really how to think through this issue of doubt and uncertainty and how to make decisions under conditions of uncertainty. And there's lots of ways of unpacking that. So I'm actually just going to start and give a heads up to all four of my fellow panel members, maybe just to reflect a bit on how you think about this idea of uncertainty and doubt. I'm not going to use the word hesitancy as Ubaka described it, but just the more generalized idea of not fully knowing and how one makes decisions. Alice was talking about individual, family, and personal decisions. Pascal was talking about public health decisions. The Public Health Agency of Canada is going to be rolling out vaccines, or is going to be trying to, and it's going to be thinking about a lot of decisions that it has to make with incomplete information. So maybe Alice, I can let you start, maybe a quick riff on doubt and uncertainty, and then I'll maybe pick another couple, maybe Pascal and then Ubaka.
Sure. Yeah, thank you. That's a great question. It's one I've been thinking a lot about, just both in my personal experience during this pandemic and before with my parents, but then also in my research at SFU. And I think what's really interesting is that sort of historically scholars thought that people always wanted to reduce uncertainty in their lives. There's a whole theory called uncertainty reduction theory. And the whole idea is, we hate this experience of doubt. It's uncomfortable, it's difficult to make decisions. And so we just do whatever we can to diminish the uncertainty in our lives. And sometimes that means, seeing things or choosing not to see certain evidence because it conflicts our beliefs. But it's been interesting, there's sort of now a push against that from my understanding. We're realizing that sometimes people actually can enjoy the experience of uncertainty, or that it can help them in their decision processes, or that, just this idea that perhaps uncertainty is not awful in every situation. And I think that watching some of the coverage, like the media coverage during the pandemic, it's been really interesting to see places like Wired and the New York Times putting out, these long articles about the scientific process and about all the uncertainties that are inherent in that. I think I've seen the Globe and Mail do some of this as well in their reporting of just, unpacking that black box a little bit and letting readers and audiences sort of see a little bit behind the scenes, see that vaccine development is a messy process and that there are always going to be some uncertainties. And my personal belief, this is not evidence-based, is that people can handle some uncertainty, and that, you know, we're seeing that with some of the engagement that these articles are getting. People are interested in learning more about how science works and how it sometimes doesn't work.
Thanks,
Yeah.
Alice. That's a great perspective. Pascal, I'm going to flip it over to you quickly, because it's one thing for an individual to make a decision under conditions of uncertainty or incomplete information, have doubt, maybe even enjoy a bit of doubt here and there. That's what sort of personal autonomy may speak to. But you live in a different world, or in the same world with other responsibilities. How does the Public Health Agency of Canada, or decision makers and policy advisors like you, factor in incomplete information, knowing that a rollout of a vaccine with incomplete information is going to have some mixed messaging and probably differential uptake?
Thanks, Eddie. I'd like to basically prelude this with uncertainty. We live with uncertainties all the time. We're very comfortable with uncertainties that are long-lasting. The concept embedded in there is novelty. So novelty and uncertainty has a different angle there. And the other concept that is embedded in that uncomfortable uncertainties in this one situation is the fast evolution of knowledge. And so all of those are kind of embedded there. As many of you know, like the scientific thoughts are extremely comfortable with our uncertainties. We build on that. There's a whole science process out of this. Now, when we move this into policy, when we move this into our personal life, that's where we're confronted and in dealing with this. And again, that's where the concept of novelty is and fast evolutions and how do you feel about this happens there. As government bodies and as organizations, I don't think government bodies are exceptional in this. You do this in your families as well. You try to compensate for uncertainty. You try to either drill in and know better, and so that is a whole pocket of activities. Our research and knowledge mobilization is boosted to the maximum. I'm actually following what comes out of science right now, and it's just like it's humongous numbers. We're talking thousands of new pieces of innovative knowledge per day that is accumulating every day. And so, you know, one part of this is to be sure that science fills some of the deep gap that we have. But again, as we move really fast, it's just like it's a catching game by which there's as much to catch on as there is to fill in. And so this reality there makes it totally in a cross point that decision maker at some point needs to say, well, we've got to come up and convert on something, knowing what we know today. And this is something, and there's among the hundreds of lessons learned, this is something that we've got to do better. This is something we've got to explain better, you know, out of like how we do. And so the compensations we do as an organization is deep planning, is enhanced engagement, is a whole bunch of other kind of things that you scenario analyses, risk assessment, and you go on and on with a whole bunch of compensation to really surround you with what it would be considered as really much a collective best thoughts as today, this is very sound and this is where we are. But I must admit, one thing that absolutely we've got to do better is explain the normality of uncertainty and explain this trajectory of knowledge as a normal process, not as a failure of the system in itself. So over to you, Eric.
Thanks, Pascal. Actually, Carly, I'm going to pick up on you if you're able to. I see a semi-sleeping person, but I'm not sure if you speaking would be good or bad.
We're good to go.
Okay. I mean, you should just pick up on this because you are at the coalface of converting that information. I was mentioning the Pfizer announcement, and many of us on this call have lived through the experience of science reporting by press release, which is a pretty dangerous way of conveying complex information. It's frustrating for the scientists who wish to have 40 pages to explain the nuance. It's frustrating for journalists and others to convey complex information simply. Could you speak to the issue of how to explain doubt and uncertainty in a way that is helpful?
Yeah, this is a sort of at the core of everything we do. And it's a very huge challenge to overcome. I mean, we basically have, we're lucky at the Globe and Mail. We tend to have like 700 or 800 words to explain some of the most complex ideas. And, there's rarely room for the kind of nuance and caveats and, backstory that we'd like to see. And so, as Alice was mentioning, we are seeing media outlets sort of for the first time, report on the scientific process and really get into the nitty gritty. I was on a panel with some other COVID reporters a few weeks ago, and we were kind of marveling at the fact that, I think the lay public now, their overall understanding of certain scientific ideas has gone up exponentially because we're simply so tuned into this idea. But the challenge then with your, sort of reporting on like the doubt and uncertainty, I saw someone on Twitter having a back and forth debate about why can't we can't even talk about herd immunity anymore? Because as soon as you say herd immunity, it becomes this idea of, okay, so we're going to go the Sweden route or the US route versus, a total lockdown. And it's almost like it's become so politicized now that it's very difficult to even talk about complex ideas because people are so entrenched on either side and it's very emotional. From a journalist perspective, I think it's very important that we try and report some of this uncertainty. I was looking at the reporting on the Pfizer announcement, and there were some media outlets that really did, I think, a good job of explaining, here's what we don't yet know. This is only a couple of people. We don't know if this is going to prevent hospitalizations. I mean, really laying it out there. But then on the flip side, most of the headlines and takeaways, which is honestly what most people read, 90% effective. And I think that's really what people thought. You were seeing Air Canada stock going up, Zoom stock going down. People are getting the message, this thing's almost over, let's go party. And they certainly are, because our rates continue to surge. And so I think that, and then that's not even taking into account what's going on the internet with people sowing doubt in everything that that governments are trying to do and public health officials are trying to do. So I think we have a duty as journalists to try and get some of that nuance out there, but it's a very, very tough task. And that's why I think there does need to be more sophisticated communication from health officials.
Thanks. I'm going to sort of move on. I'm not going to give every panel member a shot at every question. I'd like to move it on. Obak, I hope you appreciate that. Becky's been typing madly into the Google Docs file that I have here, which also mimics the chat line. So I'm going to try and take some of those. Just as a follow on though, Carly, I opened the Ottawa Citizen today, and those who live in Ottawa may have seen the same thing. A very nice, large story. Alan Bernstein, president of CFAR, obviously one of Canada's most articulate scientists, explaining some of this, and yet the story over 2 pages, it takes a while to get to. So what does it actually mean? Not a criticism of Alan by any means. I thought the quotes are great, the story was great, but it becomes how do you fit all this in? And by the time you get to the end, it says we still don't know a lot, and there's a lot we need to learn before. Well, we're already over to what is Eugene Melnick going to do to recognize Alex Trebek, and you sort of lost the story. So I want to go to the audience list, and just hopefully this is all right if I do this arbitrarily, because I'm sitting here. There's a view, and Obak, I'm going to tip it off to you. I'm not going to name who asked it. I don't think that's required. You may have seen their name on the chat line, but the question is, at what point does the collective imperative outweigh individual concerns? In other words, is there a point where it's appropriate to insist on vaccination in the public interest? You were sort of alluding to these various views along a spectrum, and maybe you can start off with a response to that question.
That's a great question. I do think that there is a point where the need to protect the public will outweigh individual perspectives on this. There's a reason why we have public health as a thing in our society, and there's sort of this notion that there comes a time where the interests of the public will have to be taken into account, and there may be a suppression of individual interests and even rights in order to achieve that. But I think that point, you get to that point where some of those considerations that I talked about are all present in a way that allows you to push the collective interest in a manner that's supportable. To break it down to nuts and bolts, because I don't have time to go into the intricacies of those considerations and what they amount to. I think in the context of childhood infectious diseases, where you have vaccines that have, for the most part, a long-term safety and efficacy profile. They're very well understood. They target a population that is vulnerable by default, where adults have to make decisions on their behalf. Many of these diseases are very contagious. They are serious diseases for people who are at the very early stage of life. If they get affected, it impacts their life. It's 1 or 2 doses and you're done, and you have lifelong immunity. I think there's very compelling reasons in that kind of situation. And I have argued in the past that there should be mandatory vaccination in those circumstances. By contrast, if you look at the flu vaccine, as I explained in my remarks, you might see that you want to sort of take a different approach that's not based on mandatory policies. So I do think there's a point you get to, and if all the stars align, you can be much more directive in terms of how you achieve public health goals. And in other situations, you might want to use a different strategy. The thing to keep in mind is that public health really is about citizenship and trust in institutions. And we may have personal doubts, personal misgivings, but at the end of the day, it's about stepping outside of ourselves for the sake of the community we live in. And if we leave that to personal responsibility, it starts to break down at a certain point. There's a point to which you can trust personal responsibility before you say, well, there's a reason we have governments and there's a reason why we have collective will. And if we have to impose that, so be it. So that's it's a loose answer, but I think there is a point. And in the context of vaccines, that will be childhood infectious diseases and the vaccines that address them.
I think it's a great segue. On my screen, Ubaka happens to be on the far left screen in this massive Brady Bunch Hollywood Squares version of what we're doing. And Alice is way on the far right side, but I actually want Alice to come in and maybe react to that same question. Not so much Ubaka's response, but I mean, I think we're all facing this issue, and that is at some point there will a decision will be made for those who are living in civil society. This is a shout out to one of the IOG's other projects on looking at the social contract and the social compact and what it means to be a part of society. What rights do you give up in exchange for what benefits or protections? So Alice, I wonder if you would reflect on that same question that we had heard before: is will we come to a point? Would we ever come to a point? And just reflect on that from your experience, but also your new knowledge that you were describing so eloquently before. Could you imagine a time? Ubaka talked about the stars being in alignment. That's a charming vision, but will there ever be conditions under which we just have to say it's time to go forward for the good of society?
I mean, I think this is the $1 million question, right?
It's probably the $1 trillion question.
I mean, I really hope we never have to get to that point. I think that's really my answer. I think that, here in BC, we have done pretty well with COVID, for example. And I think one reason is that Bonnie Henry, our public health, sort of our primary figure giving us this guidance, has been very human. And she has been very sometimes it's frustrating, we're giving these sort of recommendations instead of laws and orders. And, there have been some laws, but overall there's been a sense that we have to make our own health decisions, but we should really consider these things in our decision-making as citizens. And I think that goes to that question of public health really is about citizenship. And it's been interesting to me to be here in BC and actually see that many of these things are working, this sort of trusting people to make good decisions and trusting people to be sort of experts in their own lives. And I think especially because there's all these aspects to vaccine hesitancy and vaccine rejection that we sometimes don't always talk about, like the religious opposition that Ubaka mentioned earlier. Do we feel comfortable telling somebody to abandon their religious beliefs to become vaccinated? And in many cases, the threshold you need for vaccination, it's not 100%. And so perhaps there's some space where we can still let people feel like they have agency in society, because this is a big power of being a democracy, This is why we are not a dictatorship, is because people feel like they are active citizens. They are active participants in our society. And I think that if we have to come to that point where that's no longer possible, we will have really lost something. If that answers.
Thanks, Alice. I'm gonna flip it over to, sorry to interrupt your finishing sentence there, flip it over to Pascal, because I think in some ways you've so elegantly described the kind of civic dilemma, and that is we are enjoying certain benefits, and we don't have to just look across the border and watch what is unfolding in the US and do the comparison, we're better, you're better, but things are coming to us with a fire hose. People, I remember during the election of Trump and Hillary Clinton, when people were saying, I just don't want the government involved in my Medicare. And it was like, but the government is responsible for Medicare. So the idea of autonomy and agency is really interesting, how it is affected. And I think you described it quite well. And I'm not making Pascal the defender of all things collective. He's our Jeremy Bentham, our closet utilitarian. I just think that there is it's this really interesting dilemma of how to properly balance, if balance is the right word, certain rights and responsibilities that people feel are entrusted to them by living in a democracy. There's a reason why China has done so well, and other countries have done so well. So rather than sort of set that up too much for you, I just wonder if you would maybe take a stab at this same question about sort of rights and agency and the collective civic expectation we have of each other in government.
Thank you, Eric. And we can even push this one step further, as we're living here in Canada, we're lucky to live in something called a co-federation. So we've got layers of attention that we do to collectivity. It's not that we come down from a top-down approach too much. The angle I'm going to take there, and the one I'm very vividly attached to, is that we've got to go way further than communication. It's not telling people, it's not asking people, it's bringing them along with you. And that is way deeper through the whole tool set of knowledge building, engagement, and that's a collective conversion. It's not one that pulls the other. It's really that collective conversion. And you can see that you do societal comparisons across the globe, and you can think of social issues in some places being addressed differently. And in that case, pandemic is not that different than climate change, is not that different than pollution, is not that different than other kind of a very difficult kind of complex stuff. The bottom line is we've got to pull together as a collectivity. We've got to be one thought to move the dial. And so one thing that taught me is I'm picking on Carly's comment there, is that we've moved dial on common knowledge now. Public health is a very difficult concept to start with. And so, and nowadays we're talking about public health every day. And so if one thing comes good out of this, is that I think the collective understanding of the consequence of one action to another is there, and collectively that engagement will be there. The desire to know more about that will also be there. But at the end of the day, back to the ethical consideration there. So we've got to be mindful of respect. We've got to be mindful of justice. We've got to be mindful of the multi-layers of collectivity that we are. And at the end, we are. And so that's where it's a slow process more than an answer that we ask when we do this. Of course, we wish to collectively be together, but we thrive out of our differences. And so public health is really in the middle of all of this. And but the point I really want to make this, sometimes we come across as telling people. And I think this is another kind of a ceiling we've got to break. We've got to be with the people. We've got to engage. We've got to collectively progress on a topic much more than telling them about what that is. And of course, in an emergency, you've got to balance this. You can't afford to take the 5 years of collective progression, yet you need to tell, please don't do this. This is really going to be harmful. But yet at the end of the day, the long haul, the long progress on collective progress will come with knowledge, will come with engagement. Thank you, Eric.
Thanks, Pascal. Just to note, we're going to be winding up in about 3 or 4 minutes. I know this is raced by and we feel like we've just cleared our throat to get started. But Carly, I want to maybe come back to you, not so much on this same issue, but you are in the business of knowledge curation, accumulation, repackaging, and it would be certainly disrespectful to all of us who think about information and its complexity to ask you to explain how journalism does this. I'm more interested in how you think about the collective responsibility of conveying information. We have already several examples. What is a randomized clinical trial? We got a question about placebo-controlled trials and what do they mean? And there's this old story of it being the gold standard. And those of us who watch that language say that, yes, gold is a very malleable metal. So calling it a gold standard means that you can manipulate the data. I'm not one of those people, but there are so many clusters of types of information, public attitudes being conveyed correctly, the medical science being conveyed correctly, the status of the law and the protective powers of the state. I don't ask you to lament being a journalist, but you're one of the mechanisms in a free and open society of conveying information to the public. Can you maybe speak briefly to some of those challenges? Because I think it will help us summarize. And then Ubaka, I'm teeing you up for the next question, so get ready.
Sure. We are, the gatekeepers to information, and I think that, to give our readers credit, people are, in a sense, they have some scientific literacy, or, they're certainly capable of understanding very complex topics. And, COVID-19 is unique because people are paying attention more than they ever would. I mean, typically we could never get away with talking about randomized controlled trials in a regular news story. I mean, you can try, and certainly, I think we're in a lucky position at the Globe where we have the luxury of a little bit more space. We're one of the few remaining large publications out there, I mean, and one thing I would lament is that as we see more and more newsrooms close down and more journalists be laid off, there really are fewer and fewer places to go for that really good, relevant news information. And, on a daily basis, I think there's a lot of frustration out there, rightfully so, with the fact that there is a ton of, news, quote unquote news that gets the science wrong. We uses a mouse study to talk about how this is going to be a new cure for some type of cancer. Coffee's good for you, it's bad for you. Wine is good for you, chocolate is good for you. These things make most health reporters want to tear their hair out. And, we're sort of here trying to do some good work and get some good information out. But it is just is so difficult because the amount of information that's coming out on a daily basis is just mind-boggling. I mean, I get hundreds and hundreds of pitches a week, not exaggerating. And, some of these are from organizations or companies that just want to get a headline to sell some product, and so they might get an editor who doesn't know better or know the nuances of health reporting to sort of put it on the internet, what's the harm? And meanwhile, we're trying to, and sometimes, I'm not saying we're perfect or that, I've made my share of mistakes, that's for sure. But, I think it's very difficult especially in this day and age, to try and, convey things in a way that is responsible, that makes sense. And there's very little room. People have very little appetite. I mean, you'd be probably shocked at how little people actually read of a news article. They might stay with you for 30 seconds or a minute. That's all the time that you have to convey some very difficult concepts. And so no wonder why there's so much polarization and misunderstanding.
Thanks, Carly. I know we're close to time, but Ubaka, I promised you sort of not the last word, but just a quickie that I think summarizes some of these points at the beginning of the end. Maybe just a quick word about how the role of the law and the role of policy is playing in here. We've actually talked about a number of ethical issues. We've talked about public responsibility. We've talked about individual rights to decide, but maybe just a sort of a tiny 10-second so that then Jeff can come over and tell us how we're going to wrap up. But I thought it would be good to wind this up with that perspective.
Thanks, Eric. I see the role of the law as being the thing that brings these different debates to some kind of cessation or resolution so that we can move on. It doesn't bring closure, but at some point, somebody has to call the question. And that's why I see the law playing a role. And historically, law has done that. Call the question. You know, the debates can't go on forever. When we have this tension between personal responsibility and collective responsibility or citizenship, at some point when it gets to a head, and I support everything everyone has said, and especially how Alice put this so eloquently, but at some point we do have to make the call. And that's where the law comes in, to bring some cessation to the disputation so we can move on.
Can't be flying the plane around all the time. At some point you have to land. I want to thank the panels, and according to my schedule, I now pass the baton over to our fearless leader, Jeff Kinder. Jeff?
Thank you, Eric, and thank you for moderating an excellent discussion. I thought it was very rich. So we're now going to move into the next phase of the evening, and I know, Carly, you're having to jump off, so I just want to thank you very much and give that baby a huge kiss. For the rest of the speakers and for Eric, Becky will be placing you into a breakout room, and so for all the participants on Zoom, I encourage you to send a chat to or a message to Becky in terms of which speaker you'd like to speak with, and she will put you into that room. We'll stay there for about 15 or 20 minutes, and then we'll wrap up the evening. So just go ahead and indicate to Becky in the chat which speaker you'd like to speak with, and she will magically transport you to that breakout room.